Hello, everyone. This is Nayiri from Low Carbon Fasting. My guests today are fellow accredited metabolic health practitioners. And I'm very excited to have them here today. Roxana Soetebeer and Jeff Clay. Welcome to Low Carbon Fasting.
Thank you.
Thanks.
Okay. So I was looking forward to this because both of you have been so busy serving our communities, because this is what we're all doing. We really want to help people and share the knowledge we've acquired through our examinations, etc. So I really want to give you credit for everything that you both are doing in your communities. Before we get there, though, for anyone who's not familiar, can you introduce yourselves and tell us about your professional background, your accreditations, etc. Roxana, let's start with you.
All right. So I have a day job, and over the years, the past 30 or so years, I got sicker and sicker. So I looked into this low carb space, which I thought was dangerous, but it turns out it really saved my life. And then I wanted to put the word out. And so I needed to get educated. I got certifications for Metabolic Health Practitioner, for Nutrition Network Practitioner, and Primal Health and Fitness Coach. And from there, it just grew and grew and grew. So my group grew, my Twitter account or X account grew, and I'm doing a weekly blog. I'm also inviting people to my podcast. It's not a podcast, it's more like a YouTube thingy on the side. So yeah, that's what I do. I know how this lifestyle works, and I want to spread the word.
Yeah, we'll talk all about your Facebook group as well, because I contribute there occasionally, and it's massive. It's big. Jeff.
Yes, I'm Jeff Clay. I live in Vero Beach, Florida. I spent most of my life, up until about the last 5 years, in West Virginia. I am trained as a general dentist. I had a 37-year career in West Virginia as a dentist, and retired there in 2020. I had full intentions of being fully retired from dentistry, but after about 3 years, I got bored, and so I returned to work about a year ago, working about 2 days a week, working actually for my niece, who obviously also is a dentist, and so I'm enjoying being back in practice, and it's much nicer when you don't have the administrative responsibilities of an owner. So it's a lot more fun just to help people and fix teeth and enjoy your, what you're trained to do. So as far as my venture into the low carb keto world, it started back in 2017 with me watching a Jason Fung video on YouTube about intermittent fasting. And I successfully used low carb and keto and fasting to lose about 50 pounds. And then I was right in the middle of an exit strategy for my dental practice, a very high stress time in my life. And life got in the way, and I proceeded to gain 50 pounds back. And so my wife and I recommitted to a healthy lifestyle in January of 2023. We went by just pure chance. I stumbled onto a link on the internet for the Low Carb USA conference in Boca Raton, Florida, which is only a 2-hour drive from my home. And so I went down there and spent 4 days in Boca Raton, learning a lot more about the low carb keto lifestyle. I did a course with Dr. Boz and lost about almost 60 pounds, and have maintained that weight loss for a couple of years. I too have completed the Metabolic Health Practitioner training from the SMHP. and have a very small, what I would call grassroots movement in my hometown of Vero Beach, Florida. We meet on a weekly basis. My average attendance is probably 12 to 15 folks, and we do 2 classes a year. Each class lasts for about 4 months, and we do it for free. I just want to share what has worked for me and what's been life-changing for me. I want to share with my community, and that's just how I get that's what I call fun. Yeah.
Well, I've heard good things, Jeff, about your classes. People appreciate that you're giving the time, and they meet up, Roxana, they meet up at the local library, in person, and Jeff talks to them about low carbohydrate eating. It's commendable, right? Roxana, you are doing pretty much the same, except that you're doing it on Facebook within your group. Tell us about your Facebook group.
So the Facebook group, the name is Reversing Insulin Resistance.
Mm-hmm.
And we started out, I remember like the first 50 members, then 100, then 150. And every 1,000 members or so, I posted to the other admins and another. So now we are 22,000. The group is very active. So you can have a very big group, but it's not active. This group is very active. And the members are very vigilant. If someone says, you could try this, then they will jump in, sometimes a little too aggressively, and correct others. So it's a great group. But that's like one thing. I did, as part also of the Power Admin group that's run by Facebook, they offered a Meta certification as a community manager.
Mm-hmm.
And there I learned that I should diversify. So I should also be on Instagram, I should be on Threads, and I should be on other social media. So I went to Twitter, and that's a lot of fun. I have, I think, 18,000 or so followers there. So my main focus, it's almost split between Twitter and between Facebook. But then there's another big thing, and that's the Dr. Berry community, the Proper Human Diet community. And I met Dr. Berry like 3 years ago, and I became one of his coaches. So first it was one of the moderators, and now we are coaches in his community. And that is a lot of fun. We do weekly Zoom lives where people just drop in, and that's also all volunteer. I'm not getting paid for that. Drop in and we discuss their problems. It's almost like a friendly chit chat, but people take away a lot from it because they have the accountability, they have the support, they have every time someone kind of thinks, is this still the good choice, this lifestyle, they're reaffirmed. So my time is pretty much divided up between these three, plus my day job. So I have to do that too, because otherwise I couldn't afford to travel to all these conferences.
For anyone watching, now we're talking about traveling. So wherever there is a low carbohydrate conference or ketogenic sort of diet conference, you will most certainly find Roxana there. So she travels across the world. In fact, you even went to the one in Switzerland last year. Was it last year? Didn't you go there?
Well, yeah,
you were in Germany, weren't you?
Yes. So at the time I was working in Germany, and then Austria. There was Austria. It isn't that far. It's a 1-hour plane trip. So it wasn't really a conference. It was more like a keto retreat, where I learned interesting things, like this oatmeal fast. And
Tell us
I know
about
it seems like completely off, but it is valid. And that was fun. That was more like an excursion. I went there with my mom, so that wasn't a conference. But the one in London was. And that one was because I traveling home via London, and then just having a layover. And then it turned out I had to stay longer in Germany. So the tickets were booked. So I went. Also just like a short hop over to London from where I was in Germany.
Good for you. So who's coming to the London one this year? Because I'm in the UK, so I'll be going to that one before coming back to the to the US, but I'll be there this year. Any of you coming?
I
or
won't be
planning
making
to?
it this year. It's in September, and there's too much else going on in
No,
September.
it's in May.
Oh, the one in May.
The one in May, the Public Health Collaboration Conference.
What
Jeff,
day?
any plans to come to this side of the pond?
For me,
Any plans to come to this side of the pond?
not at this time. You know, I'm doing the Boca conference every year. I usually sign up for that at the end of you know, when I finish one conference, I'll sign up for it for a year from now. You know, I've entertained at some point in time trying to get out to the San Diego conference that they do on the West Coast, but you know, I have my day job as well. I only work a couple of days a week, but you know, I just haven't been able to fit the traveling elsewhere into my life right now. You know.
Roxana, in your Facebook group, so it's called Reversing Insulin Resistance, and I mean, so many people genuinely are interested these days. At least they've heard insulin resistant, that there is such a phenomenon as insulin. We didn't know about it. 15 years ago, I'm telling you, none of the doctors would have diagnosed you with insulin resistance. People are coming in your group, Roxana, and I sometimes contribute if I have the time and someone's asking a genuine question. People are asking, what do I do to reverse this? So I think that alone for me is positive to see. So we have made a big leap. There is more acceptance now, and there is more acceptance or acknowledgement of the idea of reversal, that not everything needs medication. You can reverse through dietary change. One of your rules is that, you know, your group, your reversing insulin resistance requires eating meat. Why did you come up with that? Because there are vegans in your group and you don't want to see vegan posts. You say this is not a vegan group. Why did you come up with that? Because don't you think it's possible to reverse insulin resistance via any other diet? Is meat eating compulsory? Or why did you make it compulsory for your group members?
I think it is compulsory to eat a proper human diet. And that's on a spectrum. So that can be the lion diet on one end of the spectrum, and it can be a plant-based diet on the other end of the spectrum, but it has to include meat. Because, I mean, plant-based as in predominantly plants if they want to, if they can absorb it. But a pure vegan diet is not a proper human diet because it lacks vital nutrients like B12. So if people want to eat that way, I'm all for it. But they can go to a group where they do that. I have to concentrate on what's practical for most people. I want to concentrate on a diet that if you want to avoid medications, you should also avoid supplements because they are not benign. You don't know how they are made. You don't know whether they have any garbage components in them. So you want a diet where just eating the diet should be sufficient. I mean, if you think about it, we grew up as humans. I mean, not we grew up, but we evolved as humans eating mostly meat, hyper carnivores, kind of like 70% of energy from meat, 30% from plants. And this is what our biology is. So I think if we eat what our biology wants, that's how we get healthy. I'm not completely against the vegan diet. If people thrive on it, that's good. But I don't want to confuse new members that a vegan lifestyle is the way to go. They can go to, I don't know, mastering diabetes, or I don't care. They can go elsewhere. My group focuses on a meat-based approach. And yeah, that's the reason.
Yeah, well explained. And so Jeff, do you have any group sort of guidelines What do you advise your group members or your followers, people who attend your classes?
Yes, I've already encountered this on a couple of occasions, and of course the narrative in the U.S. is that, of course, plant-based is healthier than red meat and saturated fats, and of course we all here think that's absolutely false. But I tell the folks in our group, if you want to be strict vegan, then I think trying to become keto is very difficult, probably impossible. If you are vegetarian and you can live with eggs and dairy and maybe some fish and seafood, if that is included in what you feel that's okay, then you probably can pull it off. You could probably can be keto. It might be a little bit tougher than the person eating a more predominantly meat diet, but you can probably pull it off. But if you want to be strict vegan, I just don't see that as a very viable solution in the keto lifestyle. Yeah.
I want to add something to that. You can be healthy eating a vegan diet, like for a while.
Yes.
But you
Yes.
cannot be successful reversing metabolic disease with a vegan diet.
I think I must be the outlier here. I don't promote it. I absolutely do not promote it. So all of my food photos, all of my social media posts are, based on animal-based foods. But I do have vegans. I do have vegan clients. And if I have a type 1 client, right, they want to work up their insulin, they're completely lost, they need the knowledge. I can't tell them you're vegan, I can't help you. So this is why I allow people to choose how they want to eat, because with type 1, I think it's a little bit different. They still want to learn how to manage their insulin without me sort of telling them exactly what they should or they shouldn't be eating. So I allow everyone, but I don't promote it. So it's, again, I agree with both of you. You'll be missing vital nutrients on a vegan diet. And I don't know how you can keep your carbohydrates below 30 grams or below 20 grams, like Dr. Eric Westman promotes. It's impossible. I had to work with someone, actually. We were putting it on, they were using an app. We were putting it on the app, trying to come up with meal plans. It was virtually impossible. So we settled with 70 grams of carbohydrates per day. That was the lowest we could go on a vegan diet. And she said she was happy with that. She was going to follow that plan. But you're right, Jeff. I mean, it's impossible to go lower than that. It would have been impossible without compromising the protein component.
Yes. And it's 70 grams of carbs a day. Just like Roxana said, I don't think that person is going to attain a state of ketosis to, reverse any metabolic, diseases they might have or health issues that they may face, So, yes, I think, I think they can do it, and I certainly never try to change someone, and because there's a lot of different reasons that people choose to be vegan, and I certainly don't want to get into that, discussion to say I'm right and they're wrong, but it makes a steep uphill climb to try to get the ketosis on a vegan diet.
And maybe many people would do fine with 150 grams of carbs. And they would even be able to get better and improve on that. But it'll be more difficult. So I'm not banning vegans. I'm not saying this group is not for vegans. I'm just saying this is not a vegan group. So there's a slight difference. I welcome vegans into the group and they can listen, but I'm not going to allow discussions where they say vegan is the way to go, or even worse, how could you, for moral reasons, eat this diet? So this is about health. And it's about a proper human diet, and that includes animal products.
Mm-hmm. Mm-hmm.
Very good.
Roxana, you mentioned, and Jeff also, you mentioned weight loss. So let's start with Roxana's sort of personal journey to where you are now. And I think it's a story that's more than just weight loss. Tell us about, your health journey.
Yeah, this is more than just weight loss. I was at a point where I was on insulin, super obese. That's an extra category they added now. So it's over morbidly obese, it's super obese. I had inflamed fatty liver, NASH, so non-alcoholic steatohepatitis, one step short of cirrhosis. I was doing very poorly. And one night, actually a week, my blood sugar went completely out of control, high 400s for a week straight. My son is type 1 diabetic. And I was already on insulin, but I didn't have fast acting insulin. So I borrowed some of his. And then I thought, oh, maybe I did too much, because I mean, you're in such a daze, your head isn't thinking straight. But I stayed up, checked my blood sugar every half hour, and a friend recommended watching Dr. Stephen Phinney. And this, from complete hopelessness to, oh, this might actually work. And so that night, I decided I'm doing keto. So I lost a lot of weight. My A1C returned to normal, but still on insulin, like 5.2, from 8.5 to 5.2. And but I couldn't get off insulin. And then starting Jason Fung, the intermittent daily fasting, basically just skipping breakfast. I got off insulin then within 2 weeks. And so everything really changed for the better. I had more clarity. I had a more joy. I didn't need insulin anymore. I didn't need metformin anymore. NASH, the inflamed fatty liver, reversed, and I lost 120 pounds. So I still want to lose more. And I have but I'm no longer super obese. I'm no longer morbidly obese. I'm so just below morbidly, I'm overweight. And I'm really happy about that. And that sounds weird, but I know that I'm going to go further down. So yeah, and I thought when I went into the store and into this journey that this was going to be so restrictive. But now I find that it's actually freeing, because when I see people eating junk food or biting into a store-bought cookie where I can basically taste the seed oil, ugh. So I don't, it's not that I'm mourn not being able to have that anymore. I'm actually glad I don't want it anymore.
I have to say, Roxana, I mean, over the past, I would say maybe 3-4 years, every time I see you at a conference, from year to year, I would say, you're slimmer. So I'm actually witnessing some of
just a
that
little
transformation, and it's wonderful to see. You look more radiant. Each time I see you, you're smaller, you're more radiant, and you really are a shining star in our community. Hats off to you for all that you're doing and for all your accomplishments.
And post-menopause, I should add, because most people say, oh, I'm post-menopause, so nothing is going to change now. No, this all happened after I was long done with my fertility years.
Yeah, and that's in the show. I know how hard that is. I know how hard that is. So, Jeff, so you lost 50 pounds, you said. Other than that, did you have any health issues?
So, I must say that I have been overall blessed with good health through my lifetime. I did not battle with a lot of health issues. Had a strong family history of heart disease. Both parents had stents in their heart. Two brothers with stents in their heart. One brother had a severe heart attack, and it was nearly fatal, but he did survive that. And so, I had some symptoms of possible heart issues. And so I had a very cautious family physician who, all I would have to do is barely mention something that even remotely sounded like a symptom that may have something to do with my heart. And I ended up with the, I think 3 stress tests and a heart cath. And, thankfully, those turned out normal. But, something that I did battle that I thought was more of a problem then than I do think that is now. But I battled, high cholesterol, and my physician had me, as many folks are, on a statin for probably 10 years. And yes, I had side effects from the statin along the joint muscle pain and that type thing. And so, since my journey into the keto world in the last, at least the last 2 years, I've got much more clarity about my feelings toward cholesterol and LDL levels, and the physician that actually I'm blessed to have my personal metabolic physician to be Dr. Savas, who I know both of y'all are familiar with. Dr. Savas practices only an hour or so drive from my home. So, between his help and I've gotten clarity about that I don't really think the total cholesterol and LDL levels are a concern any longer. So I elected to make the choice to take myself off of my statin probably more than a year ago, and immediately felt better, less of the side effects. And I was probably more worried about the long-term side effects. We all know there's many, many side effects with taking statin drugs, and to include higher risk of diabetes, type 2 diabetes, higher risk of dementia. Lots of bad things can happen. So, I'm not taking any prescription medication now, and as Roxana said, I felt so much better as far as mental clarity, as far as energy. It's just been a wonderful experience.
Yeah, and I can say I'm not taking any medications either. For someone who's lived with type 1 diabetes for 47 years, I'd be expected to have kidney disease by now. That's number one. Probably, abnormal lipid certain numbers. So I'd probably be on statins. Well, I was offered statins and I politely declined. My coronary calcium score was 0. And I feel generally healthy. So I think there is freedom, using your word, Roxana, from earlier on. There's freedom also in being free of the unnecessary medications and their side effects.
Yep. And the statins, I think the blanket statement to say statins are just poisonous, I don't subscribe to that, because in some cases they are probably needed, but in most cases not. And I would say definitely not for primary prevention. Like putting statins into drinking water or just as a condiment to French fries and burgers. No. It's not a benign drug. People think it's just going to help save lives, and it doesn't. Not in a certain context. So you have to look at the context. Is my LDL high? Will the statins lower it? Yes. Is my LDL high because it's my physiology and it's a response to what I eat? Then it might not be worthwhile cutting them and cutting a lot of other enzymatic processes in the body. So you really have to think twice before taking it. Straight out saying, I won't, probably not. But in your case, CIC score 0. Why?
Yeah, exactly. Again, it's the guidelines, and so I don't really I don't like speaking negatively of my primary care doctor or my diabetes doctor. They're doing what they've signed up to do, right? I mean, they're following the guidelines, but they were very happy to add to my notes, this patient refuses statins, but it was offered to them, and I'm very happy with that. But anyway,
Yep.
so moving on to the other side of freedom, following this way of eating gives you freedom from addictive behavior. Roxana, you'll identify with that, right? So tell us about that. Freedom
Yeah,
from cravings.
Yeah, that's a topic very close to my heart, because many people will say on social media, there's no such thing as sugar addiction because no one eats sugar from a sugar bowl. And yeah, no, I wouldn't either, but I pop these hard candies like, one after the other, right? And then I broke off a tooth. And you'd think, okay, so don't eat those anymore. But an addict really can't control that. So I broke off another tooth. Oh. And I had to just stop eating sugar. So a lot of people can say, okay, I'm going to drink alcohol in moderation, and that works for them. It doesn't work for an alcoholic. And the same is for a sugar addict. Eating sugar in moderation doesn't work. So I had to completely stop eating sugar. And that's when I felt, okay, now I have control. Before, I didn't have control because addiction is the opposite of control. And I just did this talk in Las Vegas, so all these things are very fresh in my mind. I People need to know that it's the same with ultra processed foods. They are designed to make you overeat. So you have a certain amount of population, you have a certain amount of food they will eat. To make them eat more, they have to make the food addictive. And then they will eat more and they can make more money. It sounds like a conspiracy, but that's business, right? So, yeah, getting away from this compulsory eating of ultra processed foods of sugar, that's freedom. That is freedom, because they don't, or the food doesn't control what I eat. I control what I eat.
And you choose not to eat those foods, so because you cannot moderate. And I think that's a very good point. Any thoughts from you, Jeff, on on the moderation? No harm in sugar if you can moderate it, but most people
Yes, I am much. I see folks having much more success with abstinence versus moderation. Some people, as Roxana said, may be able to pull that off. I can't. Peanut butter was my kryptonite, and there's not a jar of peanut butter in my home. Because it would certainly call my name, and it's remarkable in this keto space that a lot of folks have a very personal story, a personal journey, and I think that maybe why it makes us much more effective. Sometimes I feel like we go to our physicians, and number one, they have been. They probably have very little training in nutrition. They probably, some of them have never had a struggle with obesity or health issues, and they pretty much chalk up our lack of success to gluttony or slothfulness, laziness, and it's very much an addiction issue that's a big factor in this. And I think when we're coaching folks and we've been there and we sit where they're sitting, it just helps us be more effective in the help we try to provide these folks. Because yes, I lost 50 pounds, but I'm not sure how much I completely believe the BMI charts as far as what's normal and what's overweight and what's obese, and is that written in stone as accurate, and that type thing. But I'm still in that overweight category, and I would love to be in the normal category, and I still am on my journey, toward in improvement in my weight levels and improvement in my health. And so, and I think that again, that makes us more effective when we're working with folks on a daily basis, that we can identify if we've never had the issue and it's never been a struggle for us. I'm not sure we could be nearly as effective.
Yeah, I completely agree. And you're talking of the journey. We are forever going to be on that journey. There will never be a time where we say, that's the end of my journey. I've done everything, because you can't give up. You can't give up on what you've done, because you will be sick again, right? It's like when people say, okay, I've reversed my insulin resistance. Now I can go back and, and eat what I was eating before. And 2 years later, they're diabetic, type 2 diabetic. And then they're surprised. Well, it will come back. It will come back with a vengeance. So you're never at the end of your journey. You're forever on it. And you just have to keep, I mean, it's the same for me as a type 1 diabetic. I cannot just say one day, I'm just going to act as if I'm not, right? It just doesn't work like that. So, I cannot ignore my health. I'm forever on that journey. So, and it's what gives us strength.
It's not a destination, it is a journey.
It is a journey. I love that. Yeah, I love that. So, okay. So yeah, Jeff, you raised a very good point that when we have a particular problem ourselves, or when we've experienced it, then it resonates with people more, the people that we're coaching. This is why many of my clients, for example, are type 1 diabetics. There are thousands of certified diabetes educators out there. Why are they coming to me? Because they know that I also am type 1 diabetic. And because they've already considered the low carbohydrate diet as an option for them. And they know that that's the strategy I focus on. So they come to me. So again, I have people with severe food addictions. As of now, I cannot help them. I am not the right, I don't have the right knowledge or the training to help them. I know that we learned about it, right, in our MHP certification, but it was just very brief, how to identify it, how to perhaps even kind of diagnose someone, but then how to offer therapy. That's something I cannot do at the moment. So I refer people to others. Jeff, do you encounter people who have addictions, and so regardless of all the knowledge you teach them in your classes, they go and they cannot implement any of it?
Absolutely. I think that I think most folks that we deal with have some level of addiction. I think there's all different levels, and some folks are more successful at getting victory over their addiction, whether it's in the dietary world of processed carbs and sugar and refined carbs and that type thing, or whether it be other substances. Folks have varying degrees of success, but I think the addiction part of it is a huge component. We can fill our folks with knowledge about what they should do and should eat and shouldn't do and shouldn't eat. But when they're standing in front of the refrigerator or pantry in the evenings, and then it's a whole different story. They have the knowledge, but their addiction oftentimes wins. And so we try to provide support. I'm like you. I don't think I have necessarily the expertise to completely do it all myself, but I certainly try to help my folks that are in my group recognize that this is certainly a component that they most likely have to come to terms with, their relationship with the food.
I think with true addiction, though, people might go to programs like the 12-step program. It's that what helps. As a coach, I can give them tools. I can tell them, what if, like, you're faced with a food choice and you want to put it in your mouth, then just pause before you do it. Just pause and think, how will I feel right after? Or how will I feel 5 minutes after, an hour after, the next day? And just this little pause might just connect them enough from the impulse of straight away eating it. Then they will have me sitting on their shoulder, whispering in their ear. They hear my voice. What Roxana say, like, pause. And so it's the one thing is acknowledging, though, that they have an addiction, because if they say, no, actually I can moderate, and as long as they're doing that, they will not be able to stop the behavior. So from going through this myself, I have empathy, I have my experience, and I can relate to them. Can I heal their addiction? It really depends. It really depends. I got over it by myself, and some can get over it by themselves or with the help of a coach, and some really have to go into therapy or do a 12-step program.
I'm going to mention Dr. Vera Tarman here and Dr. Joan Ifland. She's a lecturer that I think she was in San Diego when you and I met her there, Roxana. So they have very active Facebook groups, and I'm in both of them. I'm not an addict myself. So all these stories that people share, very personal stories, are fascinating for me. And I've learned so much from, from the honesty of members in those addiction groups. And I think learned to understand how difficult it is for people. I think I appreciate the complexity of addictive food addictions, which I perhaps didn't maybe 3 years ago. It's easy.
I would like to add, I talked to Joan Ifland during this Kick Sugar Summit, and there are programs in place where people go to a place to get rid of their food addiction. And these people tell them, well, the ultra-processed food, you don't want to entirely stop eating that, because then you'll feel the urge, like it's going to grow and grow and grow like a rubber band, and then it's going to snap, and then you're going to binge. So they have the completely different approach. That's what Joan Ifland said. She also said, immerse yourself, be in these groups, listen to these videos, to these podcasts. If you are in a crisis, just listen to that. And that might help you just pull you out just enough to make a good choice. So definitely there are like many, many, many tools you can employ to help yourself and maybe also to help others.
Mm-hmm. Yeah, they are different. I mean, Dr. Tarman's group, they offer different techniques from Dr. Ifland's group, but both work.
Mm-hmm.
And it's wonderful to hear success stories every now and again. People say, I was the one who posted 3 years ago. I'm now, no longer an addict. Well, it's wonderful to see this, and you learn so much from those groups. What else should we talk about? I mean, it's the same when it comes to low carbohydrate lifestyle, right? People know that they can perhaps reverse their diabetes, but some people, despite everything you say to them, despite everything they watch, hear, they don't want to make a lifestyle change. They're happy with their medications, and there's nothing you can do, even if these people are your loved ones or they're within your family. There's nothing you can do. So it's the same, similar thing with the addiction. They have to acknowledge that there is a problem, and they're ready for the solution.
I think they're preserving their own being, like their own self, because as long as they say I'm not addicted, they can still do all these food choices and say no, addiction isn't real. Or I'm diabetic, but that medication is gonna manage it, and I'm gonna be fine with it. They don't. Well, they might see the constant decline in their health, and they might even have amputations and complications, but they will still say, "No, I'm managing it, so I'm still doing fine." They're basically lying to themselves, but it makes them feel okay with their decision. It's very hard to. It's like explaining opposites to a 3-year-old. How do you explain it? Like there's no. You can show them pictures before and after. It's when they don't want to see it, they won't.
I think with some people also that reluctance is partly because they're afraid of the challenge, because they think it's going to be too big a challenge, too big a change, and they will not succeed. And so they just ignore it. Oh no, it's not for me, right? What do you think?
It reminds me of something what I learned in that MHP course. It is that people are afraid of change. So and you'd think like, no, humans are like all for change. Like this is how we got so great. But no, on a very deep level, they are rather in pain than when they change, not knowing where they're going. So the new place could be more painful. So they rather be uncomfortable and in pain than change.
Fascinating.
And I think some folks, I think they don't, they probably don't even realize it themselves, but I think they certainly use their food as to manage their emotions, so when you start talking to them about making changes in their big changes in their nutrition and taking away the things that make them feel good and warm and fuzzy and comfortable, that's very, very scary. Where I grew up in the mountains of West Virginia, we had a very old saying that said, "You can lead a horse to water, but you can't make them drink." And so I have found that many times. Whether it be friends or family, they absolutely have to be receptive. They have to be ready to make those changes themselves. But as bad as we would want or try to help them to make those changes, it's something that absolutely has to come from within. And I mean, we can educate, we can show them what the results of lifelong poor nutritional choices and where they will be, as they age. But again, it's just something that they have to decide they want for themselves, and before we have, I think, any chance of success.
That's correct. So I want to finish off with something we mentioned right at the beginning. And I think, Roxana, it came from you. You were talking about something and you mentioned the word restrictive. I mean, let's just finish off our conversation with that restrictiveness of the ketogenic or even low carbohydrate diet. People say, well, it's too restrictive. What would you say to them?
Well, actually, I made a meme, and where it says people say keto is restrictive with lots of keto foods, but yeah, people say it's restrictive. And then below that, I say, I think this is restrictive. And it shows people alone in bed, someone being blind, someone with an amputated leg. So that to me is restrictive, not being able to go out, not being able to enjoy life, and not being able to be happy. That's restrictive. The food choices, keto, if someone thinks keto is restrictive, they really haven't tried. They haven't tried. I mean, chocolate cake. You can make keto chocolate cake. There.
What would you say, Jeff, to people who say, well, it's not restrictive or it's not sustainable? That's another one.
I see people changing their outlook as they, I think we've all seen that a lot of folks stumble into keto with the primary goal of weight loss. But most of us very quickly realize that it's much bigger than weight loss. It's the ultimate is the health improvements that we see, the diseases that we get cured, or whatever you want to, if you want to say in remission or cured, or whatever. But we often see those things, many chronic diseases, and so they come for the weight loss, but they stay for the health benefits. And I think that folks, a lot of folks, when I teach them that you can have bacon and eggs for breakfast, you can have steak for dinner, they say sign me up, they're happy about that. We actually eat delicious foods, and when we know how much it's nourishing our body, and we know how much improvements that's occurring in our health, no, I don't feel that it's restrictive. I feel just the opposite. The way I used to eat and how it made me feel, that was much more of a problem than the way I eat now.
It's definitely not restrictive. I mean, Maria Emmerich has published numerous books of recipe after recipe, and they're all ketogenic recipes, even carnivore recipes. So it's definitely not restrictive. Where would you like people to come, to be directed to? Jeff, anyone in Vero Beach?
Yes, anyone in South Florida, our Facebook page is Vero Beach Keto Community, and so that's probably the best way to reach out to me. As I said, we're in it's a small grassroots movement. We have probably less than a couple hundred on our Facebook page as compared to, I'm an admiration of Roxana with 22,000 members. Although I'm sure she has plenty of good help as far as moderating a group that size. That would be quite the undertaking to manage a group that size. So I'm sure you have lots of good help there. But yeah, that's the best way to find me.
And you also, all your links will be below, by the way, people, so don't worry if you didn't catch that. But but Jeff also sends out emails with information. Is it, what do you call them? They're not quite newsletters, but something. Well, they're kind of newsletters, right?
Yeah, basically I try not to spam my members inbox, so usually one, possibly a couple of emails a week of just, topics of interest. It might be a great podcast that I've seen. It might be a great documentary. I'm really excited and looking forward to finding out how I can watch the cholesterol. Is cholesterol code? Is that right, Roxanne? I know you saw the premiere of that. Is that right?
Yeah, that was amazing. The cholesterol code by Dave Feldman.
Yeah, well, I'm looking forward to seeing that. But I'm just always looking for information that would be helpful to our members, and so I send out an email, once, twice a week. And so if anyone wants to be on that list, I'd be honored to add your name to it. If you'll see a link to my contact information in the show notes, and so I'll be happy to add you to my list.
Yeah, I'm on that list, and I enjoy how you take the time. It takes time to put your favorites and the information together, and you're doing it on a voluntary basis. So it's I do appreciate that. I enjoy the newsletters you send out. I also enjoy Roxana's blogs. Roxana, why don't you also mention your very last blog, which was an experiment you did that you learned about at one of the conferences, and it wasn't a low carb or carnivore experiment. It was weight loss, I think, right? Was it weight loss?
Actually,
by
Yeah, it was a low
following,
carb
the
experiment.
rice diet. I think we've been hearing about the rice diet from actually Duke University, where Eric Westman is, but it was before him. So there was this rice diet and people were losing weight on the rice diet, but obviously it wasn't sustainable because you're missing out on loads of nutrients by eating just rice over a short period of time. But yes, people were losing weight. So you did something similar. Tell us about that before we wrap this up, because I think it was really funny how your community members were like, what on earth is Roxana doing? That's not low carb.
The people on my page, not the group, on the page, they lost their, I can't say the word. So they thought I'd gone completely crazy, and I was now promoting carbs, and I was just indulging. I wanted to eat carbs because I needed an excuse to eat carbs. So the thing is, Dr. Karl von Norden, German physician 100 years ago, was the very early adopter of a very low carb diet for for diabetes patients. So, and then one tool in his toolbox was a 5-day oatmeal fast. It's hypocaloric, so including about 30 grams of butter. It was under 1,000 grams, under 1,000 calories. It was under 130 grams of carbs, so technically still low carb. That's the definition. And I had 2 of them with a little bit of cinnamon, a little bit of sweetener. Really tasted actually good. The surprising thing was I was never hungry. I was still in ketosis. Not every day, but some days. I did it for 4 days. I dropped about 4.5 pounds and regained 1. And the interesting thing was that my glucose baseline went down. A point, like in millimole. So that was a lot. And at the same time, my insulin went down. So it wasn't that my insulin went up to squash the glucose. No, both went down. And so some applauded the experiment for what it was, an experiment and a tool for people. When I eat carnivore, I cannot eat less than 0 grams of carbs. So there's nothing I can employ as a tool. But this oatmeal fast is just something really different. And it's not just because it was hypocaloric, but there's a fiber in oatmeal. It's called beta-glucans, which apparently the liver loves. So it helps the liver clean out some of the fat. And it's usually done between 5 and 7 days, I think. So I did it for 4 days. I'm going to repeat it, but I'm actually not. My next thing is going to be Lion Diet again. So I'm not addicted to carbs. I didn't feel compelled to eat more and more and more. And it wasn't really well, I told one doctor, well, I felt great. And he said, well, of course you felt great. You ate carbs. Okay, so, but some really liked it, some didn't, some hated it. And some people said even I would put people's lives at danger. So there you have it.
Well, hats off to you. I really appreciated it. I appreciated the fact that, you measured everything before the experiment, then you measured your glucose and, insulin again after, and you had daily updates. And we have to do these experiments. We have to keep an open eye about, things that other people are doing that's working for them. That's what I always say. Yes, I promote low carbohydrate diet, but if you're doing something else and you're in optimal health, who am I to say, you're wrong? And this is how Nick Norwitz started his experiments. This is how
similar to the Oreo thing, but like two things really stood out. After I finished the oatmeal fast, I went on the plane trip home because that's why I finished it. And on the plane trip, I got a bowl of fruit, and I thought, well, let's see what happens, because I had still the CGM on, and there was not even a blimp from the fruit. And a few hours later, another fruit of bowl, there was not a blimp. So it really did something, and it also, interestingly, shifted my mindset to being sometimes I eat just a few too many things of the things I shouldn't. Not outright binging, but and this kind of shifted my mindset back to, okay, I'm going to be serious about this again. So there's it's not just for people who are in optimal health. It's actually an intervention, and this is important. It's not a diet. It's just a 5-day intervention.
Mhm. Well, with that, people, we're going to wrap this up. So thank you very much. As I said, all of their links will be below. So please follow them, read their newsletter, subscribe, and whatever else you want to do, and share this podcast with your communities. Thank you so much for this wonderful conversation. I really enjoyed it.
Thank you.
Thank you.
Bye for now.
Bye-bye.